This is our third podcast for the child with malignancy and altered genitourinary status. We are starting with our GI disorder, and that the one we are going to use is acute post-streptococcal glomerulonephritis. All right. This is a kidney infection that happens after someone has had strep. It is a complication from a bacterial infection, which is streptococcus, and it affects the blood vessels in the kidneys. Now, if you remember from AMP or 150, 151, you remember that lack of perfusion causes acute kidney injury. And when you have an acute kidney injury, you either are pre-renal, intrarenal, or post-renal damage, right? When we're talking about acute glomerulonephritis, we are talking about intrarenal kidney damage, all right? This, you can see here, it's a autoimmune reaction from a group A beta hemolytic strep, antigen antibody reaction, or an infection, most likely pharyngeal or skin. We're going to see a picture of that in a second. This can happen, guys, after someone has had strep and they don't take their entire course of antibiotics. Although we talk about antibiotic resistance and other reasons why you would not want to not take your full course, here is yet another example of why you would not want to do that. And here are those strep and the impetigo, and that's what it would look like on the skin, okay? Now, the etiology does have a latent period of 10 to 14 days. This is, honest to God, my favorite slide. It is totally my favorite slide. I did not make this slide, but I will never delete this slide, and here's why. It is most common in the winter and spring, or later summer or early fall. So pretty much you can get this anytime, right? That makes me laugh every time I read it. What they're saying is early summer and late fall. You don't generally get this, but come on. It's pretty much saying anytime. Anyway, there are multiple cases in families, and secondary attacks are rare. When we get together and we're talking about this, we will talk about how many people have had strep and how many people in their families have had strep, and you'll see that more often than not, people who have had strep in their families have had strep. I don't have any family members who's had strep, and I've never had strep. So you'll find that to be the case most of the time. All right. As far as our signs and symptoms, our clinical manifestations, periorbital edema, so you'll see that swelling around the eyes, like in this picture right here. Anorexia, so no appetite. Hematuria, so this is really dark brown colored urine. It is often referred to as Coca-Cola covered, something to think about as you are drinking your soda right now. Oliguria, remember, decreased urinary output. Kidneys are not functioning well, so you're going to see oliguria, you're going to see protein in the urine. Edema, pallor, circulatory congestion, irritability, lethargy, headaches, abdominal discomfort, dysuria, and mild to severe elevation in blood pressure. So we really need to be careful because blood pressure could get very high. All right. Diagnosed by all these things, you can see UA, electrolytes, BUN creatinine, so we're checking the kidneys. Cultures of the pharynx, we're culturing for the strep throat. Sed rate elevation. Serological tests, so the ASO, the ASKAs, and the AHAs, those are antibodies, checking for antibodies that produce that strep A. All right, just checking for strep. And a chest x-ray that may show fluid buildup, okay? As far as treatment and management, we're talking about antibiotics, modifying nutrition only for a very short period of time. We're going to limit the protein, potassium, phosphorus, and salt for a short time. We're probably going to see antihypertensive given, again, for acutely short period of time, not forever. And we want to make sure we're maintaining fluid balance. So we may see a possible fluid restriction depending on the fluid and electrolyte imbalances, okay? As a nurse, you will be doing vital signs. Obviously, that always includes blood pressure, but we're watching for that acute hypertension. Daily weights, because that's the best indication of our fluid status. Remember, we want to be weighing the person in the same kind of clothes, the same time of day. Eyes and O's to make sure we're maintaining those fluid balance. Excuse me. You can see the rest there. These kids, while they're recovering from the illness, they are not contagious, but they really shouldn't be around other sick kids because it can make their illness worse, okay? Remember, the first indication of kidney function improving will be an increase in urinary output, and the urine will be less concentrated, okay? And as far as nursing diagnosis, we're going to talk about acute pain related to the edema and swelling of the kidney. Pain meds are given, plenty of rest are given, positioning because of the kidney hurting, so they won't want to lay on that side, possibly warm compressions, excess fluid volume related to renal impairment, so we want to be very careful with I's and O's. We want to make sure they're not alguric. Imbalanced nutrition, they're not going to be hungry, but they may be excessively thirsty. We have to be very careful to maintain a proper balance. We may have to retain those fluids. We will have to educate families about infections like this and causes, and we have to educate them that the child is going to probably be fussy for a while, and so the caregivers have to be very patient, and it can cause caregiver role strain. All right, that concludes this lecture for genitourinary alterations. Thank you.